Page 50. Diabetes Solution, by Dr. Bernstein. Part 1. Before you start. 1.1 Diabetes. The basics. Diabetes is so common in this country that it touches nearly everyone's life, yeah or will. The statistics on diabetes are staggering, and a diagnosis can be frightening. Diabetes is the third leading cause of death in the United States. According to the most recent statistics compiled by the National Institutes of Health, NIH, as of 2007, a staggering 10.7% of the U.S. population over 19 years old, or 23.5 million people, have diabetes, with about 350 million diabetics worldwide. About 25% of those people do not know they have diabetes. About 88% have blood sugars in excess of the very high levels recommended by professional diabetes associations. This number will no doubt increase. It is estimated that 66 million U.S. citizens already have pre-diabetes, which I would treat as diabetes. Most death certificates of diabetics do not list diabetes as the underlying cause of their heart attacks, strokes, kidney failure, hypoglycemia, ketoacidosis, or fatal infections. If it were included, it might well be the leading cause of death in the United States. On top of this, there is growing evidence that the incidence of many forms of cancer goes up considerably for people with elevated blood sugars. According to the American Diabetes Association, more than 1.6 million new diabetics will be diagnosed each year, more than double the number predicted in the 2007 edition of this book. Even more alarming, the incidence of type 2A, or what was once known as maturity-onset diabetes, among children 18 years old and younger has skyrocketed. A Yale University study of obese children between ages 4 and 18 appeared in a March 14, 2002, issue of the New England Journal of Medicine. The study found that nearly a quarter had a condition that's often a precursor to diabetes. According to USA Today's story on the report the same day, the incidence of type 2 diabetes, the form that usually occurs in adults, has increased in young people, especially Hispanics, blacks, and Native Americans. Some studies suggest that in some regions, the incidence of type 2 in children has jumped from less than 5%, before 1994, to up to 50%. That children are increasingly getting a disease that once targeted 50 to 60-year-olds presents a new and frightening potential public health disaster. A huge portion of U.S. healthcare costs, $218 billion in 2007, is spent on the treatment of diabetes, mostly for long-term complications. Each year, tens of thousands of Americans lose their eyesight because of diabetes, the leading cause of new blindness for people ages 20 to 74. 90 to 95% of diabetics have type 2 diabetes. Because 80% of type 2 diabetics are overweight, many inappropriately feel that the disease is their own fault, the result of some failure of character that causes them to overeat. Since you are reading this book, you or a loved one may have been diagnosed recently with diabetes. Perhaps you have long-standing diabetes and are not satisfied with treatment that has left you plagued with complications such as encroaching blindness, foot pain, frozen shoulder, inability to achieve or maintain a penile erection, restrictive lung disease, hip and leg pain, or heart or kidney disease. Although diabetes is still an incurable, chronic disease, it is very treatable, and the long-term complications are fully preventable. For 65 years, I've had type 1 diabetes, also called juvenile onset or insulin-dependent diabetes mellitus, IDDM. This form of diabetes is generally far more serious than type 2, or non-insulin-dependent diabetes mellitus, NIDM, although both have the potential to be fatal. Most type 1 diabetics who were diagnosed back about the same time I was are now dead from one or more of the serious complications of the disease. Yet after living with diabetes for all these years, instead of being bedridden or out sick from work, or dead, the most likely scenario, I am more fit than most non-diabetics who are considerably younger than I. I regularly work 12-hour days, travel, sail, and pursue a vigorous exercise routine. I am not special in this regard. If I can take control of my disease, you can take control of yours. In the next several pages I'll give you a general overview of diabetes, how the body's system for controlling blood sugar, glucose, works in the non-diabetic, and how it works and doesn't work for diabetics. In subsequent chapters we'll discuss diet, exercise, and medication, and how you can use them to control your diabetes. If discussion of diet and exercise sounds like the same old thing you've heard again and again, read on, because you'll find that what I've espoused is almost exactly the opposite of the same old thing, which is what you've probably been taught. The tricks you'll learn can help you arrest the diabetic complications you may now be suffering, may reverse many of them, and should prevent the onset of new ones. We'll also explore new medical treatments and new drugs that are now available to help manage blood sugar levels and curtail obesity and even overeating. Page 52.